Absolutely something. In fact, the World Health Organization is one of the most important, yet often overlooked institutions on the planet. While it might not make headlines every day, its impact is felt in nearly every corner of the globe, often in ways we don't even realize. The World Health Organization, or WHO, is the planet's designated driver for public health. Headquartered in Geneva, Switzerland, it's the nerve center for international health policy, research, and emergency response. When a new disease emerges, or a health crisis erupts, the world looks to the WHO for guidance, coordination, and expertise. Think of it as a global doctor's office, coordinating health efforts across nearly 200 countries. It brings together doctors, scientists, and policymakers from every continent, all working toward the same goal: keeping humanity healthy and safe. Its job: track outbreaks, fight diseases like polio and HIV/AIDS, and set standards for clean water and safe medicines. The WHO also monitors health trends, issues warnings about potential pandemics, and helps countries prepare for emergencies before they spiral out of control. Thanks to the WHO, polio is nearly eradicated, and countless lives have been saved through global vaccination campaigns. These efforts don't just protect individuals, they help entire communities break free from the cycle of disease and poverty. The organization also tackles less visible threats like malaria, tuberculosis, and neglected tropical diseases. By distributing mosquito nets, providing medicines, and educating communities, the WHO helps prevent outbreaks before they start. The WHO is the world's immune system, imperfect, sometimes slow, but essential. When disaster strikes, whether it's Ebola in West Africa or a new strain of flu, WHO teams are often among the first on the ground, coordinating the international response. It's a hub where scientists share data on new viruses and flu strains, helping create vaccines and spot threats early. This global network of labs and experts means that when a new health risk appears, the world can respond faster and more effectively. The idea: a disease anywhere is a threat everywhere, so we need one organization watching out for all of us. In our interconnected world, a virus can travel from a remote village to a major city in a matter of hours. The WHO's job is to sound the alarm and help countries work together to stop outbreaks before they become global disasters. But the WHO isn't a world government. It can only go where it's invited and relies on countries to share information. Its power comes from cooperation, not enforcement, which means it must constantly build trust and relationships with governments around the world. Diplomacy and persuasion are its main tools, which means it sometimes has to play nice with uncooperative governments. Negotiating access, sharing data, and convincing leaders to act quickly can be a delicate balancing act, especially when politics get in the way of public health. This is a critical weakness, especially when countries hide information or act in their own interests. When transparency breaks down, the world becomes more vulnerable to outbreaks that could have been contained. Still, the WHO's work mostly happens in the background, until a crisis hits and suddenly everyone's watching. In those moments, the world is reminded just how vital this organization is, and how much we depend on its expertise and leadership. The US, as the biggest and most powerful member, played a huge role in shaping the WHO's direction. American funding, expertise, and political influence have helped drive many of the organization's most ambitious projects. But that relationship was about to change dramatically. Political tensions, shifting priorities, and global crises would soon put the partnership to the test, with consequences for the entire world. And that's where our story really begins, at the crossroads of global health, politics, and the future of international cooperation. Why did the United States, after nearly 8 decades of partnership, decide to walk away from the World Health Organization? This wasn't just a bureaucratic move, it was a seismic shift in global health leadership, sending shockwaves through international communities and raising urgent questions about the future of pandemic response and cooperation. The official explanation was simple: the WHO mishandled the COVID-19 pandemic. Critics pointed to delays, missteps, and a lack of transparency that, they argued, cost lives and undermined trust in the organization's ability to lead during a crisis. The Trump administration was especially vocal, accusing the WHO of dragging its feet in declaring a global emergency, and of being too close to China. They claimed the organization praised Beijing's response, even as reports surfaced suggesting China had withheld crucial information in the early days of the outbreak. According to US officials, the WHO failed its most critical test. They argued that the agency was bogged down by bureaucracy, slow decision-making, and political interference that sometimes put diplomacy ahead of science. This, they said, made it impossible for the world to respond quickly and effectively to a fast-moving virus. In 2020, President Trump announced the US would withdraw, citing these failures. But when President Biden took office, he reversed the decision, arguing that global health security depended on American leadership and collaboration. However, the debate didn't end there. When Trump returned to the White House in 2025, he made the U.S. exit from the WHO official, signing documents that would reshape America's role in global health for years to come. The administration insisted that American taxpayer money was being wasted on an organization that no longer served U.S. interests. They argued the U.S. could achieve better results by investing directly in domestic health initiatives and forging its own international partnerships, free from what they saw as WHO's inefficiencies. On January 22, 2026, the withdrawal became official. The world watched as the U.S., once a founding member and the largest funder of the WHO, stepped away. The move left allies and rivals alike scrambling to understand the implications for global health, disease surveillance, and future pandemics. With America's departure, the stage was set for a dramatic shakeup in global health leadership. The world now faced a new era, one where old alliances would be tested, and the future of international cooperation was suddenly uncertain. The U.S. withdrawal centered on one accusation: the WHO was too close to China. Early in the pandemic, WHO officials praised China's transparency, even as Chinese authorities suppressed information and punished whistleblowers. The U.S. saw this as complicity in a cover-up, not just diplomacy. Critics argued the WHO sacrificed integrity to maintain access to China, especially by hesitating on travel restrictions and dismissing lab leak theories. Every move became a proxy battle between Washington and Beijing. Defenders say public health diplomacy is a delicate dance. Sometimes you flatter to keep the doors open. But nuance was lost in the political storm. The narrative stuck. The WHO picked China over America. Even symbolic slights like the alleged refusal to return the U.S. flag fueled the fire. The China-centric charge became the perfect political weapon. When the United States withdrew from the World Health Organization, the impact was seismic. Almost overnight, the WHO lost nearly a fifth of its entire budget, an astonishing $400 to $500 million every single year. This wasn't just a line item on a spreadsheet. It was the lifeblood of countless health initiatives, research projects, and emergency response programs around the globe. The U.S., as the largest single contributor, had always played a pivotal role in funding the organization's most ambitious efforts. The consequences were immediate and devastating. Leadership positions were slashed, budgets for critical programs were gutted, and nearly a quarter of the global workforce faced the grim reality of layoffs. Offices that once buzzed with activity fell silent, and the sense of uncertainty was palpable among staff who had dedicated their lives to global health. These weren't just numbers on a balance sheet. Behind every statistic were real people. Doctors, scientists, and public health experts suddenly found themselves out of work, their expertise and passion sidelined. Clinics and labs that relied on WHO support were left understaffed, and vital health programs in vulnerable regions were put on hold or scaled back dramatically. To make matters even worse, the U.S. didn't just walk away, it left behind a mountain of unpaid dues, totaling a staggering $260 million. This created an immediate and gaping hole in the WHO's finances, forcing the organization to scramble for solutions as bills piled up and resources dwindled. The WHO, despite its global mandate, has no real power to force a superpower to pay its debts. There's no court to appeal to, no mechanism to evict a member state, especially not one as influential as the United States. The empty seat at international meetings was a stark reminder of the void left behind. The global health community was left scrambling. Governments, NGOs, and charities rushed to fill the $500 million gap, but such a massive shortfall isn't easily replaced. Every dollar lost meant fewer vaccines, fewer disease surveillance teams, and less support for countries in crisis. Philanthropic organizations like the Gates Foundation stepped up, pledging millions to help keep essential programs afloat, but even their deep pockets couldn't fully compensate for the loss. The WHO was forced to divert precious time and energy away from fighting disease and toward urgent fundraising campaigns, just to keep the lights on. The message from the United States was unmistakable. The world's health challenges were now someone else's problem. The partnership that had underpinned decades of progress was suddenly fractured, leaving the WHO and its allies to fend for themselves. The financial shockwaves rippled outward, threatening everything from the global fight to eradicate polio, to the ability to respond quickly to new pandemics. Programs that had taken years to build were now at risk of unraveling in a matter of months. Suddenly the world's health safety net was full of holes. Vulnerable populations, children needing vaccines, communities facing outbreaks, countries battling chronic diseases were left exposed, with fewer resources and less support than ever before. The future of the WHO itself was thrown into doubt, staff worried about their jobs, leaders questioned how to keep vital programs running, and the world watched anxiously as the organization's very survival seemed to hang in the balance. The consequences of a superpower's exit were only just beginning to unfold, sending shockwaves through the entire global health system and leaving the world to wonder what would come next. The world's reaction: shock, condemnation, and disbelief. Health experts called it catastrophic, blinding the US to global disease surveillance and weakening the world's only health watchdog. Dr. Lawrence Gostin called it the most ruinous presidential decision of his lifetime. Dr. Michael Osterholm warned it would lead to more deadly outbreaks. The WHO's leadership pleaded for the US to reconsider, but the decision stood. International allies saw it as America abandoning global leadership. Philanthropists like Bill Gates called it a dangerous move that made everyone less safe. The message was clear: viruses don't respect borders, and this decision put the world at risk. So, what's the US plan now? Go it alone. The CDC's Global Health Center will bypass the WHO, making one-on-one deals with other countries for disease surveillance. Money for fighting diseases like polio and HIV will go through NGOs and faith-based groups, not the WHO. The administration claims this is more efficient, cutting out bureaucracy and picking trusted partners. But building a global network from scratch is slow, and no country has signed up yet. NGOs can't negotiate treaties or compel countries to share data. The WHO's value is as a universal, neutral platform, one place where everyone shares information. The US is trading a global party line for a patchwork of private phone calls. By leaving the WHO, the US unplugged from the world's main disease alarm system. The Global Outbreak Alert and Response Network, 250 institutions sharing real-time data, is now missing its biggest player. American scientists are on the outside, creating dangerous blind spots. The next pandemic could start anywhere, and without WHO data, the US will be slower to respond. Bilateral deals can't cover every country, especially adversaries. The US risks missing early warnings, losing precious time to contain outbreaks. American experts lose influence in setting global health standards. China and others will fill the leadership vacuum. In trying to assert independence, the US may have made itself more vulnerable. It's like building a taller fence while your neighbors see the hurricane coming. Let's talk about the flu shot, a real-world consequence of leaving the WHO. Every year, WHO labs in over 100 countries collect flu data, and experts meet to pick the strains for the next vaccine. The US used to be at the table, helping make the call. Now its access depends on the goodwill of 193 other countries. Delays or exclusion could mean a poorly matched vaccine, more illness, and more deaths. The flu virus travels the globe. Cooperation is essential. By stepping out, the US risks shortages and ineffective vaccines. This isn't just theory, it's a direct risk to American health. The US is fighting with one hand tied behind its back, all for a political statement. January 2026, the US is out of the WHO. The world is poorer, more fragmented, and less prepared for the next pandemic. The WHO, missing its largest donor and American expertise, is forced to do less with less. Most countries doubled down on cooperation, signing a new pandemic treaty. The US stood alone. Now there's a two-track world, one working together, one going solo. When the next disease X hits, the US may be the last to know. Global solidarity is harder, and distrust is growing. The US is betting it can protect itself by going it alone, but viruses don't care about borders. By leaving, America abandoned the principle that we're all in this together. The world is more dangerous now, and no country, not even the US, is an island.